Hello, my name is Eleanor Papadopoulos. I'm one of the rheumatology physio specialists here at the Royal Berkshire Hospital, part of the rheumatology team here today. We're going to talk to you a bit about anxiety and depression and some ways that you can self-help to manage those. I'm here today with Dr. Beth George, one of our clinical psychologists, who's going to go through some helpful tips with you. This has come off the back of us looking at data from nearly 50 patients on the hospital anxiety and depression score. And this doesn't just concern hospital anxieties, it's relevant to any anxiety or depression that you feel in everyday life as well. And we found that actually nearly 49% of our patients were experiencing some form of mild anxiety or depression at least. And so we thought that this video would be really beneficial for you to be able to access in order to help you manage that better and improve your self-management of the condition as a whole. So I'll just pass over to Dr. Beth George, our clinical psychologist, now to go through that with you. Thank you.
I'm Dr. Beth George. I'm a clinical psychologist with the rheumatology team, and I'm here today just to talk about a couple of simple tips and strategies that can help you at home to manage any anxiety or depression you might be feeling. This is anxiety depression about anything, not necessarily your rheumatological condition, but just for any kind of mood related problems that you might have. The first one is what we call a hot cross bun, which looks at how our thoughts, feelings, physical behaviours and physical sensations link together and interlink. So for example, if you're thinking negatively one day, or you've woken up in a bad mood, you're likely to feel a bit rubbish and not do very much, or maybe not do the things you want to do. So a really good example for you to think about is if you imagine you're at home in the night and you hear a bang, what might you think causes that bang? You might think that it's a burglar. And so if you think it's a burglar, you're going to feel quite afraid. You might phone the police, or you might grab some kind of weapon and go and find the burglar, or you might get your partner to get up and go find the burglar. And in your body, you might start feeling quite tense. You might have butterflies in your stomach. You might sweat, and really it's not a good scenario. However, think about the same situation. You hear a noise in the night, a bang, but you have a cat. And your cat is prone to knocking books or things off shelves. So you're in bed, you hear a bang, and your thought might be, oh, that stupid cat is going to knock the books over again. You might still be annoyed and frustrated, but your behaviour is going to be very different. You're not going to phone the police. You're not going to go around the house with a weapon trying to scare off a burglar. You might get up and tell the cat off, or you might just turn over and go back to sleep. So it's exactly the same situation, but how you think about it and how you respond to it affects how you feel. The same is with depression. If you're thinking kind of negatively, then you are less likely to get up, have a shower, get out of the house, do things that you enjoy doing. So linked to that is something called unhelpful thinking habits. And these are all patterns of thinking that we all get stuck in at times. There's 12 of them, and they're published on a worksheet for you to look at. But it's the idea that you might always catastrophize. So you might be in the habit of always thinking about the worst possible thing that could happen, like the bang in the night. Possibly the worst scenario is a burglar coming, which, is a possible explanation. But if you're always thinking the worst possible thing, it's going to affect your mood and your behaviour. Another one of these unhelpful thinking habits is gloomy specs. So you might know the idea of rose-tinted glasses, where you always see everything positively. Gloomy specs is the opposite, where you always see everything negatively. And then another popular one for people who experience a lot of pain and physical discomfort is should. I should be able to do more. I should be able to do the things I used to do. I should be able to do the housework. I don't know. And again, that's understandable because we all want to be able to do these things. But if we always tell ourselves should, then it puts a lot of pressure on ourselves for when maybe we have a bad day and we can't do it. So the idea with these unhelpful thinking styles is to look at them and just work out maybe if you're prone to one style more than another style. And then if you are, to start questioning, what's a more helpful point of view? What's an alternative? How can I think about this differently so that it helps me feel better and helps me do things differently? I know that thoughts can seem like we have no control over them, and we can seem to get carried away with them in our mind. So another little technique to help you with that is to think about some songs. I want you to think about 2 songs, one that you really like and one that you really don't like. You need to know the songs enough to be able to sing some of the songs. So when I say go, I want you to start singing the song you really don't like. You can sing it in your head, or you can sing it out loud if you want. But when I say stop, I want you to swap to the song that you like. Okay, so go. Sing the song in your head that you really don't like. And stop and start singing the song that you do like. What happened? You'll find that you've changed in your mind the song that you're singing. That's exactly the same with the thought. You've changed thinking about something you don't like to something that you do like. Because we do have control over our thoughts, and if you can identify thoughts that are unhelpful to you, you can change them and help yourself to feel a lot better.
So if there's any of the worksheets that you'd like to access from today, they'll be attached in the links. I hope you found that really helpful.